They call it the miracle shot, the skinny pen, the end of dieting. You've seen the before and afters all over social media. Headlines are screaming its praises. Celebrities are whispering about it. And for millions, it's the answer to a lifelong struggle. It's a revolution, right? A simple, weekly injection that just melts the pounds away. The promise is intoxicating, a future where the battle with weight is finally over, all thanks to a drug named Ozempic. But while TikTok is showing you the before and the after, it's leaving out the during, the part where you might be dealing with constant draining nausea, the part where you could face serious long-term health risks, and the part nobody wants to talk about. What happens when you stop taking it? This is the dark side of Ozempic that's getting ignored. So today, we're peeling back the layers on what this drug really is, what it does to your body, and the inconvenient truths the miracle story leaves out. The brutal side effects. Let's get real about what it can feel like to be on this medication. The most common side effects are gastrointestinal, and they can be relentless. We're talking nausea, vomiting, diarrhea, and stomach pain. For many people, these aren't just small annoyances. They are severe enough to make them quit the drug entirely. Imagine feeling perpetually seasick, unable to enjoy a meal, or constantly fighting an upset stomach. That's the daily reality for a lot of users. But it can go much deeper than that. Beyond the common issues, there are reports of far more serious complications. One of the most alarming is a condition sometimes called stomach paralysis or gastroparesis. GLP-1 drugs like Ozempic work by slowing down how quickly your stomach empties, which is what helps you feel full. But in some people, this process can slow down way too much, causing severe nausea and vomiting. While the exact link is still being studied, research published in the Journal of the American Medical Association found that users of these drugs had a significantly higher risk of developing gastroparesis compared to those on other weight loss medications. And the list of potential serious risks doesn't stop there. Medical sources and drug labels mention other severe problems that have been reported, including pancreatitis, which is a painful and potentially dangerous inflammation of the pancreas. There are also risks of gallbladder problems, acute kidney injury, and reports of vision loss. In fact, there is ongoing litigation involving a growing number of lawsuits from people claiming the drugs caused severe issues like stomach paralysis and vision problems. This isn't to say everyone will have these severe side effects, but they are part of the risk profile, a part that gets lost in the simple narrative of an easy weight loss shot. The decision to take a powerful medication should come with a full understanding of the potential costs, not just the benefits on the scale. The off-label controversy. Here's one of the most misunderstood things about Ozempic. It is not FDA approved for weight loss. Let me say that again. Ozempic is officially approved to treat type 2 diabetes and to reduce cardiovascular risks in those patients. Its massive popularity for shedding pounds comes from doctors prescribing it off-label, a legal and common practice, but one that has major consequences here. This is where it gets a little confusing because the active ingredient in Ozempic, semaglutide, is FDA approved for chronic weight management, but it's sold under a different brand name, Wegovy, and it's prescribed at a higher dose. Ozempic and Wegovy are not the same product. They have different approved uses and were studied for different groups of people. The explosion in off-label Ozempic use for cosmetic weight loss has created huge problems. First, it led to massive shortages, making it hard for the people the drug was actually made for, patients with type 2 diabetes, to get their medicine. Second, it has fueled a dangerous idea that this is a casual lifestyle drug you can take to drop a few pounds, instead of what it is, a powerful medication for a chronic disease. Then there's the FDA's boxed warning. This is the most serious warning the agency can issue. Semaglutide products, including Ozempic, have this warning for a potential risk of thyroid C-cell tumors, including a rare type of thyroid cancer called medullary thyroid carcinoma, or MTC. This warning comes from studies in rodents where the drug caused these tumors. While it's not known if the same risk applies to humans, the warning is there for a reason. It specifically says you should not use the drug if you have a personal or family history of MTC or a rare condition called multiple endocrine neoplasm syndrome type 2, or MEN type 2. This isn't a footnote, it's a giant red flag that this medication is serious business. The rebound effect. Maybe the biggest secret the social media hype machine never tells you is what happens when you stop the injections. For many people, the weight comes right back. It's so common it's been nicknamed the Ozempic rebound. One major study, the Step 1 trial extension, found that people regained, on average, about 2/3 of the weight they had lost within a year of stopping the medication. This happens because the drug doesn't cure the root causes of obesity, it just manages the symptoms. It crushes your appetite and slows your digestion. When you take the drug away, those biological signals roar back to life. Many people say their appetite returns with a vengeance, making it incredibly hard to maintain the loss. And those health benefits you gained, things like better blood pressure and cholesterol, also tend to fade as the weight returns. This points to a crucial reality. These drugs are largely seen as a long-term, possibly lifelong treatment for a chronic disease, much like blood pressure medicine. To keep the results, you most likely have to keep taking it. And with a monthly cost that can top $1,000 in the US without insurance, that's a massive financial burden. There's also a growing conversation about the type of weight being lost. Some research suggests that a significant portion of weight lost on these drugs, up to 40% in some studies, can be lean muscle mass, not just fat. Losing muscle is bad for your long-term metabolism, since muscle burns more calories than fat. While some muscle loss is expected with any big drop in weight, it's something that has to be managed with resistance training and high protein intake, details that get left out of the miracle shot story. Now, rebound gain isn't a guarantee for everyone. Some newer real-world data suggests that people who work hard on lifestyle changes can maintain their loss better than those early trials suggested. But that just proves the point. The drug is a tool, not a cure. Lasting success still depends on building sustainable habits. Beyond the hype. The Ozempic phenomenon is a perfect storm of our modern culture, our obsession with a quick fix, the power of social media, and the real desperation of people who have struggled with weight for their entire lives. This isn't about condemning the drug itself. For people with type 2 diabetes and for those with clinically diagnosed obesity, semaglutide can be a life-changing and even life-saving medication when used correctly under a doctor's supervision. But the way it's been snapped up by diet culture and promoted in slick social media clips is deeply misleading. It's been stripped of its medical context and sold as a cosmetic trick for getting thin fast. The truth is way more complex. This is a potent drug with a list of side effects that can seriously impact your quality of life. It's being used off-label in a way that creates shortages for patients in need, and the results might not even last once you stop, potentially leaving you right back where you started. So, what's the takeaway? If you are considering this medication, you need to have a deep, honest conversation with a doctor who knows your entire medical history. Ask about the side effects, the common and the rare. Ask about the thyroid cancer warning. Ask what the long-term plan is, and ask yourself if you're ready for what could be a lifelong commitment. We need to move the conversation past the before and after pictures and start talking about the during. It's time to have a more honest and responsible discussion about what it really means to use these powerful drugs, because when it comes to your health, the fine print is the only part that matters.